The pandemic has shocked and surprised health experts, governments and the general public alike. The new variant currently sweeping across the UK shows that COVID-19, the disease caused by the latest coronavirus, has more surprises up its sleeve. Another surprising development throughout the pandemic has been the endurance of symptoms, which has been described as long COVID. A new study provides the most definitive look at long COVID symptoms yet. In the largest and longest follow-up study conducted to date investigating the lingering effects of COVID-19, researchers have found more than two-thirds of hospitalized patients report at least one ongoing symptom 6 months after contracting the disease. The study, published in The Lancet, investigated the lingering effects of COVID-19 on 1,733 hospitalized patients from Wuhan, China. Each patient was followed for at least 6 months. We will use your email address only for sending you newsletters. Please see our privacy notice for details of your data protection rights. The researchers found that 76% of all patients reported at least one continuing symptom 6 months later. The most persistent symptom was fatigue or muscle weakness, reported by 63% of all patients. Around a quarter of the cohort also reported sleep difficulties and anxiety or depression. A smaller subset of the cohort completed comprehensive pulmonary testing and more than half displayed persistent chest imaging abnormalities. Another key finding was that the degree of ongoing lung damage 6 months later correlated with the severity of the disease during the patient's acute phase of hospitalization. Because COVID-19 is such a new disease, we are only beginning to understand some of its long-term effects on patients' health, said Ben Kao, corresponding author on the new study. Our analysis indicates that most patients continue to live with at least some of the effects of the virus after leaving hospital, and highlights a need for post-discharge care, particularly for those who experience severe infections. Kao added, our work also underscores the importance of conducting longer follow-up studies in larger populations in order to understand the full spectrum of effects that COVID-19 can have on people. According to the NHS, the main symptoms of coronavirus are, most people with coronavirus have at least one of these symptoms, explains the health body. If you have any of the main symptoms of coronavirus, get a test to check if you have coronavirus as soon as possible. You and anyone you live with should stay at home and not have visitors until you get your test result. Only leave your home to have a test. Anyone in your support bubble should also stay at home if you have been in close contact with them since your symptoms started or during the 48 hours before they started. A support bubble is where someone who lives alone, or just with their children, can meet people from one other household. There is currently no specific treatment for coronavirus, COVID-19, but you can often ease the symptoms at home until you recover. However, as the NHS explains, if you have a high temperature, it can help to get lots of rest.